We are here with Dr. Donald R. Nunn at Atlanta Plastic and Reconstructive Specialist, and we're going to talk about questions and answers on a brow lift. Dr. Nunn, what is a brow lift?
A brow lift is usually a procedure that has been done for years to gently lift the brows. Mostly you want the brows to lift laterally. There's been many different techniques in the past, from full coronal to endoscopic to limited incision or direct incision, which is done for this.
What are the most common procedure types that you do for a brow lift?
Well, generally I do an endoscopic or a limited incision or a combination thereof. You don't have to have the large incisions in the hairline, which can cause hair loss or alopecia, and it tends to give a very subtle improvement in the eyebrow without overdoing the eyebrow. One of the most common problems with eyebrows is that they're overdone, especially if they're lifted medially. You do not want that. Most of the brow needs to be done laterally.
Are there screws that are inserted into the skull, or where do you do that?
Usually I do a fixation screw. You don't have to use screws. You can make a channel in the bone itself, or you can put a small resorbable screw in the area where you do the brow lift to help suspend the tissues until they heal into their new position. They don't have to be permanent because the tissues are adhered to the skull and the forehead deeply and don't require long-term screw placement.
So if you use the dissolvable screws, what are they made of and how long does it take before they dissolve?
They're made out of material which is also used in resorbable sutures. Usually it takes a few months, 3 to 6 months, for them to completely dissolve.
Who is a good candidate for a brow lift?
Generally, patients that need a brow lift fall into a couple categories. Sometimes younger patients that want some rejuvenation of the face would benefit from a brow lift, along with maybe some fat transfer to the face, and maybe do not need a full facelift or even a blepharoplasty, but can get some subtle improvements with the brow lift alone. Also, it's used in older patients who need the full facial rejuvenation, where the facelift is done along with upper and lower blepharoplasty, and a brow lift is done. Because sometimes patients want to have the entire face rejuvenated at one time and under one general anesthetic.
Right. Will a brow lift change the position of the eyebrows?
Well, it does lift the eyebrows. Again, you want it to be done lateral to the pupil. That's the area that you want lifted, not medial, because it doesn't look natural if it's lifted in the middle. So it's going to lift it subtly, and sometimes the patient may, in addition to a brow lift, need some skin excise from the upper lids, which is quite common. If you do a brow lift, you don't have to take as much skin from the upper eyelid because a lot of that skin is recruited with the lifting of the brow itself.
What are the risks involved in having a brow lift?
Generally, they're very low. You're going to have some swelling and bruising, and that takes a few weeks, 2 to 3 weeks usually, to go down. There is a nerve that moves the forehead. Sometimes that gets bruised, but that's a very hardy nerve, and I've personally never had any long-term problems with that, but it has been reported in the literature, and that is a nerve that moves the upper brow. But that usually is less likely to be injured if standard techniques are utilized.
So what would you say the total recovery time would be to go back to work?
I tell most patients about, they can usually, most people go back in a week or 10 days. I mean, it all depends on if you have other facial procedures such as skin removed around the eyes with the blepharoplasty, because that probably is going to be a longer recovery than the brow lift itself. If an isolated brow lift is done by itself with no other eyelid procedures, then I say a patient's probably going to look pretty good in a week's time, and they can probably go back to work in a week even.
Great. Well, you can give Dr. Nunn's office a call at 404-255-2975, and you can visit Dr. Nunn's website at www.drnunn.com. Thank you very much.
Thank you.